We're delighted as the Welsh Ambulance Service to be working with ABMU and Welsh Government colleagues to introduce this 111 service on a pilot basis in ABMU now and then in Carmarthen later on. We've worked very hard in our preparation to launch the service, but we will also be learning and working from this pilot to ensure any lessons that we need to learn we will take on board with the view to being able to provide this 111 service for every member of the population throughout the whole of Wales.
When it's an emergency, patients know how to access our services. However, when it's not an emergency and it's urgent, where do you go? Because there's a range of options that are available to patients. Some of that could be going to see their local GP, some of it could be a pharmacist, community services, could be out of hours GP, it could even be contacting NHS Direct. So there's a range of options there. However, when it's urgent, often you go to the easiest point of access. Sometimes that will be your emergency department, rightly or wrongly. What we're trying to do with 111 is put an umbrella over some of that to try to simplify some of those points of access. So if it's urgent, call 111. There will be an experienced and trained call handler who will take your call and will be able to direct you to that most appropriate service. And we'll have trained nurses and potentially some GPs or pharmacists there who can give you that advice in a timely manner. If you've still got chest pain, clearly you'll need access to 999 services. The 111 team will direct you straight away through. An ambulance will be dispatched, and actually if you need to go to our A&E department, that will still happen in the normal way. If you need to access GP out of hours services in the same way that you do currently, actually you will go through via that line and you will be able to access GP out of hours services.
As part of the 111 pilot, the ABMU GP out of hours service has been working to make sure that our patients get the right care with the right priority in the right place and by the right professional. This has been quite challenging in a time of increasing workload for a GP out of hours service which has not just been led by GPs but traditionally also been delivered by GPs. It's therefore been fantastic to work with professional colleagues such as pharmacists and nurses to ensure that our patients get the care and the help that they need as efficiently as possible.
There's going to be many benefits to the patient, there's no question about that. The experience and the quality that we'll be able to offer will be far better than it's been up until this point in time. However, we all know that there are a number of hard-pressed services within the NHS currently. 999 ambulances are under a lot of pressure, equally so are our emergency departments. We also know that quite a few of the cases that end up going to emergency departments could actually be cared and managed in a more effective way.
There are a proportion of patients who come to the emergency department with problems that really aren't within our sphere of expertise, and some of them get told that and they don't like that and they've waited a long time to be told that. Whereas if they access the 111 service, then hopefully they will be directed to, for example, the out of hours primary care service, which some people still don't know exists, and actually at weekends and on bank holidays they come to the emergency department because they think it's the only place. By accessing 111 first, they will know about the alternatives that will provide them with better care in a more timely fashion.
This is going to be a service that is unique to Wales and the Welsh population. We've looked at some of the best practice both locally, nationally and internationally. Places like Scotland, NHS 24, they've had similar services up and running for the last 2 to 3 years and have had some really good outcomes associated with it. Equally now, you look at places like Australia, New Zealand, Canada, all of them are moving in this general direction. All of them are looking at simplifying access into urgent care services, and this is exactly what we're trying to do in Wales. Keep it simple, keep it straightforward, make sure that you get the right services at the right time.
The aim of 111 is to give it a number that people can ring where they can speak to someone who can give them appropriate advice and signpost them to the most appropriate service for their needs.
Every day in Wales, the ambulance service receives about 1,300 909 calls. These range from people that will die if immediate assistance isn't got to them very quickly, through to people with really very minor health problems such as sore throats, dizzy spells, and in some cases something as simple as a small cut. What we need the public to do is think before they dial and use the right service.
There are a proportion of patients who come to the emergency department with problems that really aren't within our sphere of expertise, and some of them get told that and they don't like that, and they've waited a long time to be told that. Whereas if they access the 111 service, then hopefully they will be directed to, for example, the out-of-hours primary care service, which some people still don't know exists, and actually at weekends and on bank holidays they come to the emergency department because they think it's the only place. By accessing 111 first, they will know about the alternatives that will provide them with better care in a more timely fashion.
111 is going to be a fantastic addition to NHS Wales, as it will allow us to build on the work of NHS Direct and make sure that when people aren't sure what to do, but they know that the patient is not in an immediately life-threatening condition, they can contact somebody for advice. This advice will be from qualified nurses who will be well trained to provide the right solution. This will free up ambulances for patients that are having strokes, heart attacks, or people that are going to die if we don't get an ambulance to them very quickly. And that's what the ambulance service is for.
It tends to be that out of hours they will come to the emergency department because they know it's open, and accessing 111 would hopefully direct them to a more appropriate and more rapid source of care rather than creating big queues in emergency departments.
What we hope is we'll get fewer patients coming with conditions that ought to be treated elsewhere, which will free up some of our space and some of our medical and nursing resource to deal with the more serious conditions which are currently flocking into Morriston.
When you come through to 111, you'll be speaking to one of our experienced and highly trained team, whether it's a call handler, nurse, GP or pharmacist, and they'll ensure that you get the most appropriate care to meet your needs in a timely manner.
The call handlers will be working to initially take the call from the member of the public when they phone. They'll take the demographic information for the caller, and then they'll use a prioritisation tool which will actually help us to identify the urgency of the call. Those calls will then go to a nurse advisor at some point who we've actually developed for their training to ensure that they have the skills to undertake telephone triage, at which point they'll ask further questions to the caller undertaking their triage, where they will be able to provide advice to the caller on anything in relation to the care that they need, which could be self-care or it could be referring them onto another department. We also have health information advisors that work within the service. These are staff that take calls from the public where they're inquiring about conditions and things that they may have, and they're looking for some further information on that, and they support the wider service by providing information about dental clinics and other services that are available to the public. All staff that come into the service have a very in-depth training programme provided to them. It tends to be between 5 and 8 weeks long. Once the staff have been trained, they become part of our team of staff in the call centre. They're provided with a buddy, which is somebody who will actually work with them to support them during their first few weeks of call taking.
When I joined 111, I undertook a very thorough training programme. In addition to this, there are nurses on site 24 hours a day should I have any queries or concerns regarding the calls that I am taking. And during the out of hours period, there are also pharmacists and GPs to hand should I need them.
Okay, well, I qualified in 2009, and after qualifying I went to work in the Royal Gwent Hospital. I worked on a respiratory ward there for 5 years. After there I sort of moved to Morriston Hospital and gained some renal experience. But then I felt it was to take my career into a new direction, and saw the opportunity here and felt that it was a good opportunity for me to come in and expand my knowledge and experience. And take my career in a different direction.
I was attracted to the role because I wanted to be in an industry that helped people, and I found that working here is the key point that has been faced. Everyone who calls this number is calling for one reason or another, that's whether it be pain or a complaint or something of that nature, and we're here to help them. We help them shoulder whatever burden that they have and help them get them to the end that they want. And it's one of the most satisfying roles I've been in my lifetime.
I like the thought of helping people. I like the thought of providing a service that is individual to that person. So rather than giving a blanket service, that person is ringing in or is emailing in for a specific reason, and it's my job then to find that information, research it and tailor it to that individual, and I like the idea of providing that service.
It's been very exciting for both our current staff and for the new staff that we're taking on. The development of the service with the 111 project is providing new opportunities, and we're seeing new developments in the way we're working, and so all the staff that we have are really excited with what's happening at the moment.
We focused on a range of patients. Firstly, those patients that we're saying have complex healthcare needs. So these are often patients with frailty problems, often elderly patients, patients who need end-of-life care, patients with mental health needs, and also, interestingly, we're focusing on moving young children under 2s through the system very quickly, because those are often cases that need to be dealt with in a certain way. On the hub, we have a very experienced GP with lots of experience in dealing with urgent care cases. We have nurses from NHS direct backgrounds and a pharmacist. Pharmacists that are not just providing advice on medicines management, which would be an obvious use of their skills, but actually advising on a range of minor illnesses and other problems that they've received a lot of training in over the last few months, and importantly very much reduces unnecessary prescriptions for example, antibiotics. One of the advantages of having a central coordinating hub with a defined point of access for example, district nurses and paramedics in the community is that these professionals can access us very quickly and easily and get advice, again, to help deal with a lot of complex patient needs in the community, and particularly for paramedics to get advice while they're on scene with patients, and in many cases to provide much more satisfactory care in the community and avoid unnecessary transport to hospital. Definitely a success from my point of view. So my point of view is coordinating the out-of-hours service as well as working in this hub, and certainly the speed with which patients are moving through the out-of-hours service has clearly dramatically improved, and we've got performance metrics that show that happening very well. It's also been a great experience to work with other professionals and to have a multidisciplinary team rather than just having doctors consulting and providing the service, which is the previous model in ABMU.